We are reshaping the process of taking care of people's sinuses.
So is the technology safe? Does it work as it's intended? So how does it perform in the patients that they would be treating? And then lastly, would the results last?
The answer to all those questions is a resounding yes.
The data from the Acclarent study, to me, is very powerful data. It looked at safety, it looked at effectiveness, and it looked at what happened to quality of life for the patients. As far as safety, there were no significant adverse events in any of those 115 patients.
And it proved to be extraordinarily safe, easy to use, and efficacious. It worked.
In those situations where you can use the balloon, it just makes it that much better for the patient.
I feel it's safe now, having seen that this has been used in thousands of patients worldwide and in thousands of sinuses worldwide.
When you look at what the balloon is able to accomplish with basically no mucosal sacrifice, with complete mucosal preservation, I think that more than anything else establishes the fundamental idea behind balloon sinuplasty.
As shown with the Acclarent study and the 1 and 2 year follow-up data, this opening has long-term patency and long-term effect.
It has been about a year and a half since my surgery with balloon sinuplasty technology, and I have felt great.
It's effective, gets them back to work quicker, and the data is now coming in to show that the results are durable over the long term.
We have really two aspects of patient outcome. One was a validated quality of life study, the SNOT-20 sinus nasal outcome test, which showed that at all points in time, there was statistically significant improvement in patient outcome.
So patients today, they're very sophisticated and they demand not only a simple and elegant solution for treatment of their disease, but they want to get back to their lives immediately.
Right after the surgery, when I woke up, I felt fine.
Patients' symptoms improve, their quality of life improves.
They're able to bounce back and get back to their daily lives on a really much quicker basis.
After my surgery to get into my car to go home, I could smell smoke. I could smell that there was a fire close by.
It makes me feel a lot better once that patient comes back and says, you know, this really helped and this made a big difference.
So in the patient registry, we basically attempted to revalidate the results that we saw in the clinical study.
And there are over 27 sites and over 1,000 patients. I think it's important to have a technology that can be translated to not just a few people, but to a large number of people.
And we saw that, and it was reconfirmed.
Acclarent has made a significant commitment to otolaryngology and to the subspecialty of rhinology.
I can recall within a 2-week period of a need, one of the engineers from Acclarent had already had a prototype in place and was showing me this, and it was just unbelievable to me.
We design clinical programs at Acclarent. We basically go to our surgeons who are advisors, and these are world-renowned in their field.
I think Acclarent's done a tremendous job of lining up large numbers of patients and really trying to do excellent clinical research. And I think that's been validated not only in numerous sites, but in other countries and with hundreds, if not thousands, of patients.
At this meeting, we brought together physicians from all over the world, and in an open-minded, free-for-all forum, we had a chance to really discuss some of the controversial issues of how sinus disease starts, how we should manage it, where technology fits into the management of sinus disease.
First and foremost, I learn of new technologies. I learn about what leaders in the field are doing.
The reason that training is essential is because it really reinforces the fundamentals of endoscopic sinus surgery.
It's also very gratifying to me to then get a feedback and follow-up from some of the people that I have helped to train, and to hear from them about how well their patients are doing.
One of the other fascinating things about this technology is that it has opened up new vistas in things that we can do. It opens opportunities that we didn't even know needed to be opened.